Hi everyone, my name is Nicolas Avellaneda, and on behalf of Surgery Journal, I have the honor today to interview a referent in trauma and acute care surgery, Dr. Paula Ferrada. Paula, how are you today?
Thank you so much for the opportunity to be here, Nicolas. I am honored to be here. For those of you that don't know us very well, we actually are now speaking English, but we're fully bilingual. También hablamos español because we're represented citizens of the world and representatives of not only one country, but we're working on a global scale of surgery.
Yes, that's true, that we have a lot of people from different countries in the world. It is very nice to have you here and also an honor. So, Paula, would you please make some introduction about yourself to the audience?
Okay, so my name is Paula Ferrada. I am a Colombian. I was born in Colombia. I trained medical school in Universidad del Valle in Cali, Colombia. I came to the United States 22 years ago, and I trained in several places of the country, Beth Israel Deaconess, my surgical residency. Then I went to University of Pittsburgh for critical care. Then I spent a year in acute care surgery and shock trauma. I worked for 11 years at Virginia Commonwealth University, and recently I took over this role of division and system chief for trauma and acute care surgery in Innova Healthcare, which I'm really proud of, and is something innovative for an academic institution. And I hold an academic appointment with the University of Virginia.
Yes, and you are actually a very well-renowned surgeon around the world, and that is something very interesting for everyone to know. Well, actually, I think everyone knows you, but no, that's okay. But so I think that you have been a leader in trauma surgery for a while now. So and also I think that you have also managed to pursue a scientific career as well. So I would like to know how you managed to do this, and also if you have any advice for young aspirants to an academic career within the boundaries of trauma and acute care surgery?
Yes, this is a great question. So I think for all of you that are listening that want to be part of a leadership role, either locally, nationally, or internationally, or do you want to pursue an academic career or a scientific career within surgery, I think the most important thing to ask yourself is why. Why do you want to do this? And I believe strongly that the why has to be bigger than just having another title under your name or another letters under your name or another little checkbox in your CV. It has to be a why that is stronger, that gives you purpose, and that fuels your energy when things don't go necessarily 100% like you want it. I think it takes, as everything in life, it takes perseverance and it takes hard work. And sometimes things are not perfect. But if you know your purpose and if you know what is the light at the end of the tunnel and what is your final outcome, you will get there. For me, I think coming from Colombia, South America, and seeing how trauma has been done in several places of the world, for me, my why is patient care. Because I strongly believe that through education and through collaboration, we can make the patient care better in places with low or medium income country, or in places where we have everything that we need. If we can come together as one and develop guidelines and develop processes, I think we ultimately will make the outcome of our patients better. And I think this is specifically important in trauma and emergency general surgery, as well as surgical critical care, because these patients don't give you too much time to think. They're sick, they're bleeding, they're septic, they're dying. So if we actually have the opportunity to think about these things ahead of time, then there are processes in place that will allow you to act faster and to get the care of that patient, do it as best as possible and evidence-based.
Yeah, I think that is a very, very wise advice to anyone who is actually young and think about this. So thank you for it. And Lastly, you are one of the star associated editors in surgery journals. There's a lot of them, but you are definitely one of them. And then this journal receives a lot of manuscripts within your specialty. So I was wondering if there is something you could say to people on your surgical specialty that are thinking where to send their publications, and then in order to help them decide for surgery journal.
So I think one thing to recognize is that the language of surgery is English. Even though our primary language might be different, like my primary language is Spanish, I had to learn how to write in English well. And I think that how we deliver information is very, very important. I cannot tell you how many manuscripts that are wonderful with great ideas, great results, might not be able to be published because of translation and how it comes across. So I think for anybody that is listening, especially those of you that are like us, that the primary language is not English, is surround yourself by people that are going to help you write and present the information in the best way possible. And that goes a long way. I think the Journal of Surgery is a wonderful journal to submit things to. It's very diverse. And that would be my piece of advice. Just make sure that the information that you are presenting is done in a persuasive and way and in appropriate English language, which to me, to be honest with everybody, it didn't come naturally. I had to surround myself with people that will help me to do that. So.
Yeah, and actually, I think one of the assets of Surgery Journal is that even if you present a manuscript that might need some reviews, you'll actually get very good reviews in order for you to get it better, and then you can send it again or just send it to another place. But actually, the kind of reviews that you will receive from people like you is one of the assets of Surgery Journal. So, well, that's it for today. It was very nice to have you here. And, well, hope that we meet again, hopefully face to face soon.
Thank you, Nicolas. A pleasure. Thank you so much. Gracias a todos.
Have a good day.